Taylor, tell me, before I make any assessment, tell me what's been bothering you. What are you trying to...
It's mainly under my eyes. I feel like I always look really tired.
Yeah.
And even when I put makeup on, I just still feel like I just look exhausted all the time. So that's my main concern.
Yeah, okay, fine. And how have you got on with your skin overall? Because it's been quite inflamed recently. Is it behaving at the moment?
Much better, yes. Yeah,
Okay.
I've been after having the Dermaluxes, I've literally got one breakout at the moment.
Okay.
So that's it's much better.
And you started using.
Of-
what are you about to?
I'm
Yeah.
using vitamin C, GF5, Retin-Ace, and Ultralight.
Wonderful. Okay, so let's follow your skin progress as well. So, with regards to this area, I can see what you're saying. So there is a little bit of volume deficit. Okay, so this is just, obviously you're young, so it's more genetic, you know, than because of aging, obviously. And because you've just got a lack of fat there and lack of support there, you've got this sort of slightly hollowed area. But there is also flattening of the cheek area as well. Yeah, and so that's when we talk about fat pads, and previously I've spoken about that to you. So the fat pad that you would normally have sitting here is a bit lacking in you. That is separate to your tear trough. So I do want to just build that up a bit first. And then that will mean that we have to do less in your tear trough, because actually this is probably a bad way of doing it, but if I lift my cheek up here, you can see that it improves my under eye area indirectly. So we'll correct that first. I'll have another look at you, and then I can put a little bit of hyaluronic acid filler in here.
Okay.
We use slightly different products, and that's, I think, a key thing that often doesn't happen. Sometimes people get the same product chucked in a few different areas and they behave differently. So we need the right product for the right area, and I will slightly undertreat, particularly the tear trough, because over a matter of weeks you're going to attract some water to that area, and what we don't want is it being overtreated and then you're having new issues.
Okay. Yeah.
So remember, when you have it done, it's still quite subtle. People often still see what's left rather than the improvement, and it's about understanding that it's about looking fresher, hopefully not getting people saying you look tired or you feeling you look tired, and then if after a couple of months, you know, we do need to just enhance it a little bit and there's scope to do that, we can of course do that.
Okay. Yeah,
Okay.
sounds good.
All right.
Okay.
So Taylor, if you just look straight ahead. So many people do complain of the under eye area, and they'll often come in asking for dermal fillers when I would have to say probably 60-70% of people who ask for it, I say no to, because they're inappropriate for lots of reasons, and I can probably do a live on that at some point. But in this case, actually, we can potentially do a little bit, and certainly laterally here. So when we say laterally, we mean the outer area. There is some scope for doing a little bit here, and possibly a little bit here. But what you can see is here, there is some relative flattening. It's not maybe as obvious on camera, but if I follow the natural curve of the cheek, and obviously we have to consider whether we've got a man or a woman here, and in the female cheek we do want some fullness here, and there's a little bit of deficit of volume here. So if we can sort this out and give this a nice curve going around, then actually it may be that in theory we might not even need to do any tear trough filler, or we'll certainly need to do less, which is what we want to achieve. It will also mean that we'll get a little bit of a rise here. We just want to keep the natural flow, that's the key thing. And then I am going to do a little bit here, because there's a little bit of a dip here, and we're going to help improve this. So the angle from the side is improved. At the moment this is up like this, and we just want to bring this out a little bit like so. Everything else here is great. We have also got a little bit of a dip here. A lot of people get nasolabial fold injections and they just end up looking unhuman. And this alienization effect that we're seeing a lot of is because people are just not really assessing the face properly. Here, there is a dip, and if you just turn your head, people like Taylor often go and get lip filler done, and then we wonder why they don't look good. Well, if you look here, she's actually got a very beautiful filtral area, that's this area here, and a very youthful one. There's no reason to do that, but if she went and got some lip filler now, particularly if the way it's often done, it would just make this hollow look even more hollowed, and it wouldn't all flow well. So we have to correct this area first, before we could even consider doing anything in the lips. Not that we have considered that at all at the moment in the plan. Okay, right, so we've only done 0.5 mil injection into this deep compartment here below the tear trough, not in the tear trough. And hopefully you can see on the camera that this has indirectly improved the tear trough area compared to the other side, which we've not treated yet. It doesn't mean we might not need to do something in the tear trough, but it does mean that we'll probably have to do less, and we might even spare her that treatment. And it sort of demonstrates how important addressing changes based on anatomical reasons. People can come complaining of one area, in this case the tear trough, but that's not even where we've gone in to treat, and that happens with a lot of areas of the face. And we have to remember that when we're consulting patients, or if you are a patient, you need to hear that and understand that the person's advising you on what actually you need rather than what you think you need. Okay, thanks. Okay, so if you want to sit up, okay, you obviously be a bit pink. Just remember, if you go to the mirror and you see one side looks a little bit different to the other, you're not symmetrical to start with, and some areas will swell a bit more than other areas. I can see that on this side, potentially I might need to do a tweak more, and at the moment it does look like I might need to, but you'll be surprised as things settle how it will change. So I prefer to do any tweaks maybe about 4 weeks time. All right, okay. So anyway, have a look, don't get too close to the mirror.
Oh my god, I actually
Don't stop
believe
filming,
that.
don't stop filming.
That's mental.
So good, isn't it?
Oh my god. Don't know what to do though.
Don't worry, it's just to get back to the camera. But
How much did you put in?
3 gallons? No, we actually didn't use that much. 1, 2, 3, 4, 5. So it looks like a lot, but actually, so each side has had 2.5 mils. And bear in mind, I did cheek, we did some in the tear trough, we did this, the piriform fossa.
Yeah.
We put some into this chin fold, so let's relax this down. I put some into marionette. So we actually treated a lot of areas.
Yeah.
So when you think of it, not a lot went in. So in total, we used a teaspoon,
Yeah.
if that's how you think about it.
Crazy. Isn't it weird just doing my chin? I feel like it just has contoured my whole face.
Yeah.
It's crazy.
And of course, what we're doing is influencing how the light hits your face.
Yeah.
So how the light hits our face is then, that's what's coming back to me. When I look at your face now, the light's hitting you differently. And so I'm going to get a different perception of the 3D shape of your face. And that's what we need to do. And that's again, when we see a lot of issues with dermal filler treatments, it's because the face hasn't been assessed correctly. So someone's going in, just chucking some filler in there, the light then bounces off in a way that doesn't give a human form to the face. But we've got a very natural, even now when there's a bit of swelling, she's got a very natural look. No one would know she's had any treatment done, and then we'll check back in a few weeks. But usually, bearing in mind a lot of my patients come from far away, we don't really have to do any tweaks, to be honest. And if anything, it's just because the person wants an even better outcome that we might need to do something more. Okay, amazing.
Well done, team.